Good afternoon and welcome to the Flint Community Webinar, your community resource. We have been here for over 6 years and we're so grateful that you continue to join us, continue to send us topic ideas that we should cover every month. And we're grateful for your participation in this collaborative effort. And please keep it coming. I'm Heatherlyn Uphold. I am your moderator for today. Usually I'm behind the scenes and you only see me through messages, but EJ was not able to join us. Jennifer Edwards Johnson, who's normally our moderator, she sends her regards and I get the opportunity to walk us through our webinar for May. We have a wonderful lineup. Let me take you through it. Just so you know, we send out the webinar reminder. Well, you probably get a number of reminders, but we send out the flyer every month, giving you a taste of what's to come. If you aren't getting that flyer, put your information in the Q&A, and we'll be sure to add you to our mailing list so that you can hear about, get your thoughts together, think about what questions you might have about the topics that we're going to be covering this month or whatever month. This week, we are talking about nutrition. We're going to get updates about food access, and then Flint Lead Free is going to give us an update. So we're going to be hearing from Gail Ship and Bridget Farmer about the fruit and vegetable prescription program. We'll hear from Nicole Lear. She's here with Extension. We're always grateful when Extension can, MSU Extension, when they can come and join us and talk about their wonderful programs and the work that they're doing in the community. And then we have Cassius Hosfeld, and Heather Schurter, who will be joining us and talking about the Flint Lead Free program. So they're going to give us an update about that. Their report is coming out, so they'll walk us through some of their results. But up first, we have that fruit and vegetable prescription program. I'm going to turn things over to Gail and Bridget to walk us through.
Okay. Are you all seeing the slides okay?
It's perfect.
Awesome. Okay. Well, thank you for that kind introduction, Heatherlyn, and thank you for inviting us to share a little bit more today. Bridget and I both will share a little bit about the nutrition programs as well as the research that's coming through the Pediatric Public Health Initiative. Okay. So first, I think it's important to start off by sharing what is the Pediatric Public Health Initiative. You all might be familiar, but in response to the Flint water crisis, Michigan State University, as well as Hurley's Medical Center, which are longstanding partners together, they launched the Pediatric Public Health Initiative with a mission to improve outcomes of Flint children. And so really prioritizing the critical window, starting particularly during pregnancy, throughout preschool. It has the goal to protect children and provide them a nutrient-rich environment, where the initiative has these 5 arms and nutrition being one of them. And so this is the PPHI nutrition team, starting with Dr. Amy Sachs-Kustak. She is an associate professor as well as the nutrition director. And then myself, I'm an assistant professor. Then we have Sarah Egan, she's a research assistant as well as over the Flint Kids Cook. Bridget Farmer, which you'll hear from today. She's also a research assistant over the fruit and vegetable prescription program, and she'll talk more about that. We have Lisa Passberg, who's also a research assistant, and then Tina Wilder, who's the chef and culinary educator for Flint Kids Cook. And so to share a little bit about both of the programs, they're the 2 major nutrition-focused programs under this initiative, which is primarily led by Amy Kustak, is the fruit and vegetable prescription program, as well as Flint Kids Cook. Again, Bridget will talk more about, we call it the FBPP program, as well as some new research findings a little bit later. And Flint Kids Cook is an amazing program which is led by a chef as well as a registered dietitian, really introducing children to culinary education experiences, encouraging healthy eating. And the kids get to learn new cooking skills as well as recipes that promote nutrition while also cultivating this love for cooking. And I'm going to pass it over to Bridget.
Thank you, Dr. Ship, for the introduction. So the Fruit and Vegetable Prescription Program partners with pediatric clinics to provide patients with prescriptions for fresh fruits and vegetables. So every patient at every clinic visit with a healthcare provider receives one $15 prescription, and it can be redeemed for fresh produce at the Flint Farmers Market or ordered for delivery through our service called Flint Fresh. Next slide, please. And there we go. So recently we have been evaluating the impact of the fruit and vegetable prescription program on ultra-processed food intake using something called the NOVA classification system. So the NOVA system is a standardized method for categorizing food items into 4 groups based on the extent, nature, and purpose of processing. So group 1 foods are unprocessed or minimally processed. Group 2 is comprised of processed culinary ingredients like salt or oil. Group 3 foods are processed and they're made by adding group 1 and group 2 foods together. And then group 4 is the ultra processed foods. So they're made up of industrially manufactured ingredients containing additives and little to no ingredients found in nature. So some examples include like soda, hot dogs, or chocolate. Next slide. So I used linear mixed effects models to estimate the change in the percent of total daily calories from ultra-processed foods before and after 12 months of participation in the fruit and vegetable prescription program. So at baseline, we found that our participants were consuming on average of 65.9% of their calories from ultra-processed foods. And then at 12-month follow-up, this decreased to 62.2%, which is still above the national average of 61.9%, but the trend's headed in the right direction. And in a sub-analysis of participants that reported high ultra-processed food intake at baseline, we found a 10.3 percentage point decrease in the percent of total daily calories from ultra-processed foods, indicating the program might be even more effective for kids who are relying on ultra-processed foods for most of their daily calories. Next slide.
Okay, so this is back to me. So thank you for sharing, Bridget. I wanted to share a little bit more about my research program. It broadly focuses on maternal and child health, as well as diet and nutrition related disparities, and the psychosocial and structural determinants that shape inequities across the mother-infant dyad. And so I would like to take just a little bit of time to share 2 studies that uplift the importance of nutrition across the mother-infant dyad. And so one of them being a maternal pregnancy BMI, breastfeeding and child BMI. And so when we look at specific nutrition related disparities, the relationship between exclusive breastfeeding and childhood obesity is really a critical area of study, and it remains significantly understudied, particularly among women with obesity. And so the current data is quite sobering when you look at women having a body mass index over 25. They actually show lower rates across the entire spectrum when you're thinking about breastfeeding intention to initiation as well as long-term breastfeeding duration. And so we're also even seeing some biological differences in human milk the metabome, and we're only kind of beginning to understand that. And so some of the most striking are anecdotal reports that some physicians are actually discouraging breastfeeding among women with obesity. And so this led us to our objective to describe associations between breastfeeding practices and child BMI for age Z-score according to maternal pre-pregnancy BMI categories. And so we hypothesized that the longer duration of exclusive breastfeeding would be associated with the lower risk of childhood obesity, even among children born to women with pre-pregnancy obesity. And so for this study, we used data that was contributed into the ECHO Consortium, in which that came from 21 cohorts. One of the cohorts that contributes the data comes from our local Michigan cohort, which is MARCH. It stands for Michigan Archive for Research on Child Health, in which it began recruitment in 2016, and it recruited over 1,000 participants from 11 sites across the state, one including Flint. With that, we analyzed 8,134 dyads for maternal pre-pregnancy BMI, as well as infant feeding practices, and having greater than or equal to one child BMI assessment between the ages of 2 to 6 years old. And then the associations between breastfeeding practices as well as continuous child BMI, they were assessed using multivariable linear mixed models. And so some of our key findings, the main thing is that what we found is that breastfeeding practices were associated with lower BMI Z-scores among children. And this was actually regardless of maternal pre-pregnancy BMI category in the ECHO study. And so essentially human milk exposure actually supports breastfeeding recommendations as a potential strategy for decreasing the risk of offspring obesity. Another one I'd like to highlight briefly is around the factors associated with fruit and vegetable intake among women of reproductive age. And this one was specifically done in Flint, Michigan, and it's a cross-sectional analysis. And so to kind of ground our discussion in clinical standards, we have to look at the foundational role of nutrition in preventing chronic diseases. And so we do know that regular intake of high fruits and vegetables is the primary defense against diet-related diseases. According to the dietary guidelines for Americans, the 2025 through 2030 guidelines, the standard recommendation still remains of having a recommended daily consumption of 1.5 to 2 cups of fruit, while 2 to 3 cups of vegetables as part of an overall healthy diet. And so while these numbers really do seem straightforward, our research investigates the structural barriers that make meeting these simple requirements sometimes a challenge for many families. And so when we zoom in, particularly on that reproductive period, a healthy diet also takes on some additional nuances. And so it's not just about fruits and vegetables, it's also about having this nutrient-dense profile, including those higher consumptions of seafood, poultry, as well as whole grains contributing to a healthy diet later for pregnancy. And again, the specific dietary pattern is crucial, again, not just for wellness, but again, the maintenance of the reproductive period and optimizing nutrition during this window, we can significantly reduce the chronic health conditions in women and try to set a healthier trajectory for the next generation. And so this led us to the study, which our objective was to characterize the associations of sociodemographic, health, and environmental factors with fruit and vegetable consumption and adherence to dietary recommendations in a unique population of reproductive age women affected by the Flint water crisis. And so just to give a few of the key findings, I can also share the paper for others interested. While the dietary guidelines, they do provide a clear target, our data actually showed a significant gap between the recommendation as well as the reality. And so our study found that fewer than 1 in 4 participants met the daily requirements for fruits and vegetables, with it being 22.8% for fruits and 20.3% for vegetables. And so this kind of suggests that simply knowing what to eat is not enough. When we look deeper into some of those factors driving these low numbers, we did find that neighborhood availability as well as perceived quality of produce were directly associated with intake. And so this is a critical finding when you're thinking about public health policy. It can kind of confirm that increasing consumption requires more than just education. It may also require some structural improvements to the access as well as quality of food in local environments. And further, we did identify several socioeconomic determinants of health as well, too, including education, income, and home ownership status, which were significantly associated with meeting these recommendations. And so, crucially, a participant's perceived health as well as well-being also played a major role. And so this data, it really does kind of reinforce this idea that nutritional equity is linked to broader systemic factors like economic stability as well as environmental justice. So just kind of thinking about our path forward, from going from evidence really to equity, improving, I think, reproductive health as well as pediatric health outcomes. It's not just the responsibility of the individual alone. And I think we hear that oftentimes in public health. We do know that early interventions matter, as some of the ones that we share today. And then also there is a systemic hurdle when you're thinking about improving nutrition for those many families. And another thing, a point to kind of point out is that geography shouldn't indicate health. And so it really requires a healthy diet that is supported by our very neighborhoods and participants that live in those areas. And so by scaling some of these evidence-based programs that we have and addressing some of the social determinants of health, we can really move forward from documenting disparities and trying to deliver more equity. And so I think Flint is leading the way with a lot of these programs being the ones shared today, designed to dismantle these barriers. Thanks.
All right, Gail and Bridget, thanks for sharing. We do have a couple of questions in the chat. Number one, what's a dyad?
So the mother-infant dyad is just looking at them together.
And so when you're collecting data from folks, you were collecting data from the mothers. You were also collecting some data about the children.
Absolutely. So for the ECHO program, environmental influences of child health outcomes in our local cohort March, we enroll pregnant women midway through their pregnancy, and we continue to follow them, but we enroll their children as well too. And so, and we follow them as well. The oldest child at this point enrolled that's being followed is around 8 to 9 years of age.
All right.
So their data is linked. It's matched.
Okay.
Yeah.
All right. Thanks for that. And it's so important because what you talk about is that we can't just say to moms or to families, well, you should just eat better.
Yeah.
You should just, go buy fruits and vegetables. And talk a little bit more about why that's not always possible for folks to be able to access healthy foods, access the kinds of foods that they feel are quality.
Well, again, when you're thinking about access, it's the area that you live in, the affordability of different things. And so it's easy to tell somebody what they should do. But sometimes it's hard when you have all of these other barriers and challenges that families are experiencing. And so that's why some of the programs that we have, particularly like the fruit and vegetable prescription program that provides these prescription programs, $15 for the children at each well visit. And now it's expanded to women during pregnancy, where Bridget, correct me if I'm wrong, it's $10 at each visit during pregnancy. And so this is just to encourage them, and they can use and utilize or redeem these vouchers at the Flint Farmers Market, Flint Fresh. And we're trying to expand to Meyer. And so making it easier for moms to access these things is really important. You can tell somebody to do something, but trying to figure out or support ways in those endeavors are also important.
Yeah. And you talked about those social determinants of health, or the conditions in the environments where we all do life together, right? Where we live and we work and we age and we are born, all of those things. And so it's considering, how far away are you from a food source that provides those kinds of foods? You can be close to a food source, but they may not offer fruits, vegetables, fresh meat that you feel is healthy or, that is fresh. Transportation to get to those. So you can see how all of those layers can impact someone's ability to access the food that they need to take care of themselves and take care of their children.
Absolutely. Yeah. And that's where we
Anything
have all these supports and systems in place.
and why we need to work together. We do have another question here. How are there plans to follow kids longer? This is to you, Bridget. Are there plans to follow kids longer than 12 months in the fruit and vegetable prescription program?
So this analysis was actually part of like an NIH clinical trial. And so we followed kids for 24 months. So we actually have the dietary data for kids from baseline through 24 months. We just haven't applied the food processing system to the data. You have to get the files from the National Cancer Institute. And so it's an application process. But we are hoping to do that in the future.
Okay, so more to come. We also had another, I love this. Thank you so much for the feedback and the questions that are coming in. Someone else chimed in and said childcare and postpartum depression can also impact access too. So it's a part of a larger system that these services are being provided in. So keep those questions coming. Bridget and Gail will be here throughout the rest of the webinar, so you can message them and ask them directly. But we're going to transition to our extension folks. Nicole, I saw you nodding when we were having our conversation with Gail and Bridget. So I'm anxious to hear what you have to say about what extension is up to.
Yeah. Thank you for having me, everybody. Let me share my screen real quick. All right. Can everybody see it okay?
Yes, perfect.
All right, great. So, as Heather Lynn said, I am here from Michigan State University Extension. I am a community food systems program instructor here in Genesee County. Um, and I am new to this role. However, I was in a previous role with Extension as a community nutrition instructor through the SNAP Ed grant. Unfortunately, that SNAP Ed grant was removed from the federal budget this fiscal year. And because of that, we ended up losing a lot of our nutrition programming that Extension offered. However, there are still some programs available, and I do want to highlight those for you guys so you can take full advantage of those. And I do want to mention that all of the programs that I am going to talk about today are offered free of cost, except for the ServSafe certification, which I'll get to in a little bit. And I will put links in the chat once I am done for all of the programs, if you would like to go and check those out and register for them. So the first program I want to talk about is our Cook Healthy, Spend Less program, and this actually came about as a result of the loss of our SNAP Ed funding. Um, so this is kind of a newsletter based series of lessons that you can sign up to receive. You will get an email weekly for 6 weeks, and there will be a different topic each week. And in those, you'll click a link and it'll go to a newsletter. And in each one of those, it will talk about nutrition information, cooking and shopping skills that you might be interested in, like meal planning and how to save money at the grocery store. There will be a different featured food group every week. So I think the first week they talk about water, but after that, they go into protein, fruits, veggies, dairy, and grains, and all of those get covered. And then each newsletter has a physical activity video that's usually around 5 minutes long and a featured recipe for you to try with a video as well. Um, the next thing I want to talk about is our expanded food and nutrition education program. And this is the only nutrition specific in-person offerings that we have currently. So in Genesee County, we were lucky enough to have two FNEP staff, uh, Brenda and Grace, who are still able to do in-person programming. Their programs cover nutrition and physical activity as well as cooking and shopping skills. And these are 6-week in-person series. So if you've ever taken the Cooking Matters classes, that would fall under what they are still doing. And we have a few other classes as well, like our teen cuisine class, our Show Me Nutrition class, and our Healthy Choices for Everybody class. Those are the main ones that they teach. And they do have specific populations that they target. So they work mainly with low income participants that are either youth, parents, or caregivers of children. And I will include a link to get connected with those programs if you are interested. And you can also email me and I can connect you directly with Grace and Brenda if that is something you would like to do. Their classes generally are not open to the public, but they do work with specific organizations that can schedule classes for their clientele. The next two classes I want to talk about are our diabetes management classes. These are done through our health educators, and both of these are online classes. So they are doing a Living Well with Diabetes webinar series right now. I believe the first one already happened, but there are 3 more, and these are on Tuesdays from 12 to 1 p.m. The May 12th webinar is focused on using diet to control blood sugar. The May 19th webinar is on making smart food choices to prevent and manage type 2 diabetes. And then the last one on May 26th will be about removing the barriers of being active to prevent and manage type 2 diabetes. And then we also have our diabetes path program. And this is another 6-week series. This is done online, and unfortunately, the last one they had just ended, so the next one isn't until November 4th. But I did want to tell you about it anyway. And these classes talk about ways to manage diabetes, um, like eating healthy and exercise plans, navigating stress and difficult emotions, how to manage the many medications you might be on as a result of your diabetes diagnosis, and then how to communicate with family, friends, and healthcare providers about your condition as well, and make those treatment options and how to evaluate those. So, those are 2 great classes on diabetes management if that is something that you are interested in. Next, we have our food safety programs. ServSafe, as I mentioned before, is the only class that I'm going to talk about today that isn't offered free of cost. There is a cost for ServSafe certification, but that is um, a class for people who work in the food service industry, either private food service like restaurants or also any organizations that serve food, like a soup kitchen or something like that, might be interested in getting this certification. Um, for our food safety hotline, this is a great resource through our Ask Extension services, where you can call with any questions you might have about food safety. The food safety hotline runs Monday through Friday from 9 a.m. to 5 p.m. And they can answer questions about things you might have, like, I pulled this meat out of the freezer 3 days ago and it just started to thaw and I'm not going to use it. Can I refreeze it? They'll be able to answer those kinds of questions for you. Or if you are interested in doing any home food preservation, they are an excellent resource for food preservation questions. If you found a recipe online, they can tell you whether or not it is an approved recipe that is considered safe because not all canning recipes are research based. the old recipe your grandma might have on making jam may no longer be safe. And the main reason for this is that a lot of the food options we have in grocery stores have changed. So, the acidity level in tomatoes may be a lot lower than it was 20, 30, 40 years ago. So that recipe may no longer be safe. So I would highly recommend if you do a lot of food preservation that you keep this food safety hotline number on hand because they are an excellent resource for that.
Wait, can we dig into that just a tick more while you're here,
Yeah. Yeah,
Nicole?
yeah.
Talk about like that's I I had no clue, and we do some of this at home.
Yeah.
Can you talk a little bit more about that?
Yeah. So, our fruits and vegetables have changed over the years, right? We farmers grow different varieties of things. Like they may prefer to grow tomatoes that are less acidic because people get less heartburn or prefer the taste of them better. So if your grandma's recipe used a tomato that had more acidity in it, may have been safe to can at that point. But the tomatoes you may be using now, the varieties that we grow and use, may no longer be safe. So they may need to have something like a citric acid or a lemon juice added to them to make sure that they stay safe while you are canning them.
And if you do can with something and like say it was last year and you had no idea that this was something that was important, will you know that the food is not safe when you open it?
I don't know. That would
Oh,
be a question to call the hotline with.
okay, that's why there's a hotline. Okay, all
Yes.
right, all right. Like, will the sniff test tell you, or should you?
I do know that the rule is when in doubt, throw it out. But we all get to decide how much risk we're willing to take with things, right? Some people like to
Oof.
jump out of planes. I don't know.
All right, all right. I don't know about rolling the dice on that one.
I
Mm-mm.
know.
That kind of, yeah, that's not so
Agree.
good. And then
Agree.
the serve safe. This is this something that's required for health or food professionals to take?
It is not required for everybody that works in a restaurant or something like that, but I do believe you have to have at least one person on shift who is a ServSafe certified manager. Don't quote me on that, but I'm pretty sure that's how it works.
Okay, all right. We do have a question in the chat, but I recognize that I interrupted your flow, so you might
You're
get
good.
to it. So I'll let you keep going. Thank you
All
for
right. Um, The next thing I want to mention are our food preservation classes. So the Preserving Michigan Harvest classes, I have taken these in the past and they are a really cool resource. They are offered every Thursday from 1 p.m. to 6 p.m. I have our upcoming ones up here. There's one on preserving for outdoor adventures. So I think that one focuses a lot on dehydrating food and what is safe to take on like a backpacking trip and things like that. The May 28th one will be all about strawberries, making more than just jam. The June 4th one is on preserving meat, so making things like jerky. And then the June 11th class is on condiments and dressings. I think there's a rhubarb barbecue sauce recipe that they talk about on that one that sounds really delicious, and I would like to make one day soon. And then there is an online home food preservation course that you can take. This is a self-paced course done through our Desire to Learn platform, D2L, that covers everything from water bath canning, pressure canning, blanching and freezing, jams and jellies, pickling, and dehydrated foods as well. And then the last thing I want to talk about is really my new passion project and my new role. And these are going to be our cooking through the season recipe demonstrations. So I will be doing these at the Flint Farmers Market on the first and third Tuesdays of the month from 11:30 a.m. to 1:30 p.m. Starting June 2nd, and these will go through October 6th. Each of these will feature a seasonal produce item. The first one on June 2nd will feature strawberries and rhubarb. And I am really excited about these. We are also going to be um, doing some um, presentations that we will probably start piloting next year that will be our Cooking Through the Seasons classes that will focus on how to source and use seasonal produce throughout the many seasons Michigan has. So these are something that I am extremely excited about. I do not have a link for these, but they will be posted on the Flint Farmers Market Facebook page. Um, and they are on the first and third Tuesdays right around lunchtime. And then I just wanted to share our contact information. So we are in the Land Bank building in downtown Flint. We also have a Facebook social media page, and our phone number is up there. If you would like to receive the MSU Extension News Digest, you can sign up for that. And then all of our staff are listed on our webpage, so you can get all of our contact information there if you are interested in any of these classes. And I am going to pop up the chat so that I can paste all my links in there.
Okay, we do have, while you're doing that, if you can multitask for us.
Yes.
Okay. We have here's a great comment. It's great that MSU Extension has so many online education and resources. You did mention some in-person activities that are going on, but are there other ways that you support access to opportunities for folks who maybe don't have a virtual option or lack transportation, like what we talked about earlier with our conversation with Gail and Bridget, that, maybe they can't make it to the farmer's market?
Yeah, so on our website there are tons of articles, pages with information. We do have a YouTube channel that has some videos on it as well. On the topic of nutrition specifically, with the loss of that SNAP Ed funding, we lost a lot of the resources that we had to do those in-person programs. I did a lot of programming at senior centers around the county, specifically the Cooking for One class. And unfortunately, that is just no more. And that just has to do, I think there were almost 100 people around the state that worked for MSU Extension under the SNAP Ed program that were let go at the end of September. So they are still struggling to find funding to replace some of those nutrition education opportunities that we used to offer. That cooking, um, the Cooking Healthy, Spend Less class
Mhm.
is our best attempt to get something going immediately that could be helpful and useful to people. For some reason, it is not letting me paste my links in the chat. I wonder if it has to do with the fact that I'm sharing. So I'm going to stop sharing for a
Oh,
second
maybe. Yeah.
and see if that helps.
We're still working through our questions here. We
All
have
right.
another person who is growing a garden
Ah.
this year. So where can they find classes to help with their garden?
Great question. So if you go to the MSU Extension website and you type in gardening, there are tons of resources on there. You can also call our garden hotline. Let me see if I can find that number and
Are
copy
you
that.
able to paste in the chat?
No, it won't let me.
No, I
I
don't
don't
think.
know why. So let me see if it works from the website. Give me just a
Hang on.
second.
Can you message me? We're doing some technical issues here on the webinar right now. Sorry
Yeah.
about that, folks.
I like had them all together. I was just gonna copy paste them in, and of course,
Oh,
it's
just in the
not
Q&A. Yeah,
working.
maybe the Q&A. Or actually, Blair, can you make her a co-host? And then maybe it's God bless Zoom. It does like to change the settings, so maybe there's a new setting that we didn't know about. Oh, look at Nicole's gotcha. Oh, you're a co-host now. Okay, you should have all of the power, Nicole. But
All right.
Nicole Jones did you a solid, and there you
Awesome.
go.
So
All
there's
right.
that let me copy and paste, but it won't do it from my PowerPoint. I had it in my all my
Oh,
links
maybe,
in my
yeah, maybe,
notes.
yeah. Hmm. Well, thank you, Nicole Jones, for stepping in
Yeah.
and putting links in.
I will work on getting those links in.
Yeah.
I might have to paste it somewhere else and copy it
Or
first.
email it to me and then I'll put it I'll put
Okay.
it in the chat. But if you want to know more, email us too, and we can get you connected. Really use the webinar and use us as an opportunity for that. We're not done with questions yet, though, Nicole. Don't go
Go
anywhere.
for it.
Just a minute. All right. Can you share those resources for upcoming diabetes education opportunities? That would be fantastic to share with our clients. This is someone from GHP, Genesee Health Plan.
Yes. If
And
you want to go ahead and throw your contact information in the chat, I will absolutely
yeah, see,
send you those
we'll get it addressed
classes.
somehow. And are the diabetes education, is that something that you can do on site too, or is that only the virtual?
So those are only the virtual options as well. And I think I figured out my copy paste problem. I think I was trying to put too much in there. So I'm
Oh,
going to do half of it at a time.
okay. Oh, there you go. Yep.
Yeah. And I'll put the rest in there as well.
But I love that idea of signing up for the digest too. I get those pretty regularly and it's so well laid out. I don't know if, you folks get newsletters or whatever, but the way that MSU is laid out, the extension newsletters, it'll say like MSU horses or MSU like something. So then like, oh, this is the diabetes one, or at least that's been my experience, which is nice.
Yeah.
Oh, yes. And then there's another question. Are there classes or education opportunities available for individuals who speak a different language or have language barriers?
We do offer interpreting services. We do need to know about those a bit ahead of a time to make sure we can arrange for an interpreter to be present at the class, and that can be an online class or an in-person class. So usually on our flyers or things like that, there will be a contact person to contact if you have any questions about the class. And if you contact that person and let them know you need interpretation services, they can make sure that someone is there as long as they have enough time before the class starts to get that organized.
And closed captioning is available for for the virtual options, right?
Yes, yes.
Things like that.
All of
And
our classes are done through Zoom, and I believe we use the Zoom closed captioning services for those.
okay. All right. Thanks, Nicole. It's so
No
nice to have
problem.
you on the webinar, but we'll look forward to meeting you in person
Sounds
at the
good.
farmers market on
Yes, please
Tuesday.
join me.
All right. Thanks, everyone. Up next, Flint Lead Free. We've got Cassius, who's going to be joining us, and then Heather Scherter.
Hello,
Oops.
guys. Hey, sorry, give me 1 second. I'm gonna share my screen. All right, can you guys see the screen?
It's perfect.
All right. So yeah, so I'm Cassius Hosfeld. I'm with the Flint Lead Free Work Group, and we're going to talk about the 2025 Flint Lead Free Biannual Report. So that's a part of the Flint Registry. We're like a subgroup of the Flint Registry, and yeah, we bring together different organizations in the community. So the goals of what we're going to talk about is kind of like an overview of the Flint water crisis as it currently stands. So where what resources are being provided and what the current conditions are. So the goal of Flint Lead Free, the work group, is to eliminate lead exposure in the Flint community and to bring together different groups of private, public, and nonprofit organizations in the community in the hopes of talking about different ways to collaborate in regards to data collection and taking action to reduce lead exposure in Flint. So another thing the Flint Lead Free Work Group does is we produce a biannual report. So we produce a report every 2 years, one in 2017, one in 2021, and one in 2023. We're producing the 2025 report right now. We're a little late. That'll come out in May of this year. And we're also going to do one next year in 2027 to keep in line with the biannual nature of it. As you see, we have the links provided. I'm going to provide this PowerPoint presentation to Heather Lynn, and I think everyone will have access to it. I'm not sure about that, but I think you guys should. So I'll provide this PowerPoint presentation. And as you see, if you click on those links in the bottom, it's the underlined white text in the bottom of the page. You can access each of these reports previously. And then we'll also share the 2025 report. These are the partner organizations of the Flint Lead Free Work Group. All these organizations at some capacity work toward improving, reducing lead exposure in the Flint community. Also, they joined some of them joined the Flint Lead Free Work Group organization or sessions, meetings, and talk about ways to collaborate more effectively. So we're going to go through several things today. First, we're going to talk about monitoring exposure, so basically lead water exposure levels right now in the Flint community and also blood lead levels. We're going to talk about primary prevention tactics, so basically ways in which lead is reduced in the Flint community, lead exposure is reduced. We're going to talk about secondary prevention tactics. So basically getting resources, getting individuals connected with resources, individuals who may have been exposed to lead during the Flint water crisis, getting them access to these resources that may help with their health outcomes. And then we're going to talk about an MDHHS informational session in June that we're promoting. So monitoring exposure. So Flint Lead Free recognizes that there's no safe level of lead in water, right? The US has an action threshold of about 15 parts per billion. Michigan has an action threshold of about 12 parts per billion. The action threshold is basically that 90th percentile of testing. So if 90% of the tests come back with, like, let's say 10 parts per billion lead in water, then that will be below the action threshold, right? And that will be okay, but it's still not safe, right? The safe goal is to get 0 parts per billion of lead in water, right? That's the goal for Flint community and nationwide, and potentially globally as well. Lead can be released, and lead is primarily released into homes through lead service lines and lead indoor plumbing. The federal government passed legislation in 2024 mandating that all lead service lines be replaced nationwide. Now, the city of Flint is a little bit ahead of that because of the Flint water crisis. They've been doing this since 2016, and we'll talk about that. But that's kind of how lead in water happens. That's how lead leaches into water. And what we see in Flint is that there was a spike in 2016 in lead testing, as well as a number of parts per billion amounts of lead in water in 2016. These data are provided by the city of Flint. The city of Flint provided voluntary test kits to individuals and households in the city. This data matches with state data, where they find that the 90th percentile of lead water tests found that 20 parts per billion was the 90th percentile for homes in Flint in 2016. These numbers dropped over time, so those numbers were well above that federal action level. Those numbers dropped over time, but they still remain relatively high, right? So in 2022, it was 10 parts per billion. In 2025, it was 6 parts per billion. The goal is to get it to below 1, right? The goal is to get it to 1, which was in 2024, or 0, right? I'm having no lead in water in the city of Flint, in city of Flint water. But the city's doing a better job, and everyone's doing a better job of keeping it low. Testing, MDHHS does lead testing in blood for adults and children. If a child is found to have elevated blood lead level, which would basically be 3.5 micrograms per deciliter or higher of lead in their blood, then they're referred to different organizations that may help with these health outcomes. So if a person is found to have an elevated blood lead level, the goals are to 1, identify the source of the lead, 2, stop the lead exposure, and 3, determine any other tests or follow-up that might be needed. And as we see, the percent of children under the age of 6 with elevated blood lead levels in Flint, it was very high between 2013 and 2019. It was over 5% all those years. It's dropped since then to about 2.5%, which is better, but the goal is to get it to 0%, right? The goal is to get it to as low a percentage as possible for those children, as well as all populations in Flint. So the numbers are improving, but they still are higher than what would be the goal. So how do organizations get lead out of homes in Flint? The primary way is through abatement services. This is professional containment, identification, and removal of materials that contain harmful substances, predominantly lead in Flint, right? The LSHP, the Let's Safe Home program, helps households do this through a stipend. They basically connect households with different organizations that do lead abatements. They cover 100% of the costs, which is great because these costs can range from $10,000 to $30,000 per project. However, a home must apply. To apply and be accepted, the home must have a household income within the federal poverty level of 138%. The home must be enrolled in Medicaid. The home must be habitable or structurally sound, and the home must not have been already referred to the City of Flint HUD program. The City of Flint HUD program also provides these abatement services at reduced cost. However, they also have eligibility criteria, which is that the homeowner, the person must be a homeowner or rental property owner, and they must have a child in the home under the age of 6 or a pregnant woman in the home, pregnant person in the home. So let's say that you apply to the LSHP, you have been accepted. What happens next is you get an environmental investigation. Basically, what this is that they check for lead hazard in the home, right? Drinking water, dust, paint, soil, things like that. Between 2015 and 2023, the city of Flint conducted 1,000 environmental investigations, 88% of these uncovering some kind of lead hazard. The majority of these lead hazards actually were not with drinking water, they were with dust or with paint. 26% of these investigations were with drinking water. These abatement services have been very productive over time. 665 total abatements by the LSHP between 2013 and 2023. 60 total abatements by the city of Flint between 2020 and 2023. Another organization that does these abatements is the Poisoning Prevention Fund. They do something very similar, but they cover 50% of the cost, not 100% of the costs. So these are great services provided by these organizations. They provide a stipend. They provide money to get these lead abatements done, and it's really good for these individual households who need lead out of them. The Genesee County Habitat for Humanity helps Flint households do the same thing. They help to mitigate lead exposure in homes, and they also help to provide abatements or abatement type services. I want to emphasize some things. They provide a lot of information, Habitat for Humanity. I just want to emphasize that they have done 966 faucet cartridge repairs, 766 window replacements, 235 water heater installations, and 32 home repairs in partnership with MDHHS LSHP between 2015 and 2023. So they are a very productive group doing a lot of work to get lead out of homes. The Genesee County Land Bank Authority, they do something similar. They basically receive funding to demolish vacant homes built before 1978. 1978 is the year that legislation passed so that homes are no longer allowed to have lead in them, be built with them, sorry. So those homes built before 1978 have a higher risk of lead being in them. Between 2013 and 2023, 4,000 vacant homes were demolished by the land bank. And these homes were demolished in using safe practices so that lead did not get through contaminate into the community. So I said this earlier, but the city of Flint is ahead of the game in regard to steel pipe replacements. Between 2016 and 2022, the city of Flint replaced 10,000 lead or galvanized steel service lines, and only in 2024 was this made a mandate for the nation. So the city of Flint is ahead of the game in this regard, in getting lead pipes out of Flint. The MDHHS also provides accreditations, trainings, and workforce development. Basically what this does is it helps get individuals trained to enhance their ability to do abatements, and it gets organizations certified to do abatements. Between 2018 and 2023, 9,700 total individuals were certified, 1,000 organizations were certified, and 1,000 individuals were trained through the MDHHS lead training program. Lead exposure basically comes about, lead exposure costs come about through healthcare costs and criminal justice costs. Criminal justice costs being lawsuits to the city, lawsuits to the state, healthcare costs being people's direct healthcare costs, but also being unable to work or unable to be productive because of deleterious health effects over time. The Pew Research Center and Robert Wood Johnson Foundation estimated a total benefit of $84 billion for the United States in eliminating lead exposure. And for Flint, between 2013 and 2021, those abatement services, demolitions, and service line replacements are estimated to be about $201 million in estimated benefit. Again, that's through reduced healthcare costs, improved lifetime earnings. People are healthier. They're not reliant on different systems or stipends, and and they can work longer, right? They can be more productive. So secondary prevention, one of the primary secondary prevention groups in the city of Flint is the Flint Registry. They're a CDC-funded project that connects individuals to services that help to reduce lead exposure or to help promote health outcomes. Basically, the Flint Registry, they refer individuals to things like the LSHP, service line replacements through the city of Flint, or health and nutrition secondary sources. Between 2019 and 2023, the Flint Registry produced 35,000 total referrals, 3,000 of these referrals being the LSHP, 6,000 of these referrals being the City of Flint pipe replacement, and 25,000 of these referrals being health and nutrition or education services. I'm going to pass it over quickly to Heather Schurter. She's going to talk about CHAP and what she does with them.
Hi, I'm Heather. I'm with the Mid-Michigan Community Health Access Program. And just give you a quick overview of the OB lead screening program that we put together starting in 2019. CHAP created 12 evidence-based questions on a screener that we provided to a couple of our OB practices. We've now partnered with those practices. They provide that screener to their clients. If the woman answers yes or unsure to any of the questions on the screener, they refer that client to CHAP. And then one of our nurses will then reach out to that pregnant woman and provide her with lead education. And if it's appropriate, we'll try to get her connected to a lead testing and abatement program, with the goal being that the home could be tested for lead hazards, hopefully abated for them before the baby is born and mobile in that environment. And the goal, of course, is to reduce childhood lead poisoning, getting ahead of that lead. We also work with that woman to get her connected to any social determinant type of issue, or social determinants that she needs, such as transportation, getting her connected to WIC or the maternal infant health program. So between 2019 and 2023, we had 1,134 total referrals, and the majority of them were clients on Medicaid. Some of the other ways that CHAP works with lead, we do work with any children that are found to have elevated lead level are referred to CHAP, and we then work with that family through nurse case management. That means working with the family to go through a nursing assessment, a plan of care, getting them connected to a lead testing and abatement program, staying with them to ensure that the child is continuing to get lead testing done, removing any barriers to healthcare that might be getting in the way of getting to the doctor's office, getting to the lab. So if they need transportation, we're going to help them with that. We also work with families to prevent lead poisoning. So if we know there may be a potential issue with a home, we're going to work to ensure that that family is connected to one of those lead testing and abatement programs. All of our staff is trained on what to look for if they should go out to a home visit and they notice potential issues with paint in the home. They can always tap a nurse then, and we're going to reach out to that family and offer to provide them with some lead education. We work with doctors' offices and Medicaid health plans to ensure that children are getting the lead testing they need. The OB program that we just talked about. And then we have a more recent partnership with the Genesee Land Bank, so that individuals who might be purchasing a land bank home can elect to have a CHAP nurse reach out to them and provide them with lead education, the types of precautions they might want to be taking if they're doing renovation. The EPA has a lot of great guidance on the types of precautions that they need to take when doing renovation, where there may be lead hazards present in that environment.
I know we're running out of time, so I quickly just want to emphasize that the MDHHS will be hosting an information session on June 23rd at 1 p.m. in the City of Flint Dome on South Saginaw Street. Again, here's the QR code, and here's a phone number for this information session. It's basically on individuals or organizations that want to get professionally qualified for lead abatement services. And here is a QR code for the Flint Registry resource page. This resource page has information on lead abatement services, on demolitions, on service line replacements, and secondary resources for anyone who may have been affected by exposed to lead and has corresponding lead health outcomes. Thank you very much.
All right, thanks you two. We do have a quick question in the Q&A. I think we have 30 seconds to get to it. What lead abatement services are available to seniors over the 138% poverty level?
That is a really good question and a very specific question. I think I would point you to the lead poisoning prevention funding. I think they may, I'm not sure about their qualification criteria, but I do know that I think they may be a little less strict in regard to income than the LSHP.
And something to note, it would be important to indicate whether maybe they're providing childcare in that home to grandchildren.
Okay.
That can also influence the programs that they might qualify for.
Okay, so might offer some more flexibility for that. Okay, I see Nicole Jones put in the chat link. If there are other links that you can pop in, that would be helpful. And always email us and we can get you that information. We do have, I'm going to spend just 20 seconds on this. We have a new process for getting CEUs for our community health workers. So you still fill out the questionnaire, that Qualtrics survey like before, but then once we get that survey, Blair, who's behind the scenes, has been operating the webinar for us today. She sends you an email with the certificate that then you can take to Mishwa for your CEU. So just a little bit different process than what we've done before, but still able to give you those free CEUs for our wonderful community health workers. This has been a wonderful webinar. We're so grateful that you joined us today. All right.
Sorry about that. I couldn't Google it fast enough.
Yes. But
Uh-huh.
it's such a good question.
Yes, it is. It's matching funds, but yes. Great. Thank you, Heatherlyn, for another fantastic webinar.
Thank you all for joining us. As always, this is the way the webinar turns out. You get started on a conversation, you're like, oh dang, I want to go like deeper into this. I want to spend more time talking about fruit and vegetables or all the stuff that extension is up to, or getting to the questions today, but just not enough time.